I think it's time for us to start. Oh gosh, am I excited to be back? I missed everybody the last 2 weeks. I thought I would be relieved not to have the jam for 2 weeks. That's not how it turned out. I actually missed you guys. So here we are, really excited for the jam today. We've got Corbin here. He's going to talk in a few minutes, but let's get started. So little tidbit, here is someone climbing El Capitan. And today we're going to just your little preview is AFSP's big, hairy, audacious goal, Project 2025. And we're going to hear about that in a few minutes, before 10 after the hour for sure. Next slide. Great. So if you don't see your organization on here, please let us know. We think we've captured everybody, but we know there's always new people joining. And we've got our horse race still going. Which sessions have been most attended? Look at how YouTube is almost catching up with Zoom on some of these. So we're really catching people on YouTube, which is amazing. And again, the learning community is over 3,000 now. It's amazing. It's great to be part of this. And I'm so proud of the work that this group has done. Has the Crisis Jam disappeared from your calendar? No problem. Go right to the Crisis Jam website. There's an easy way to download the new calendar link. Make sure it's on your calendar so you don't miss us every week. And so that people who might put things on your calendar know you're busy. All right. You know where our website is. Always go there. You can listen to old things. I've revisited slide sets where I was like, what? Who said that again? That was an amazing comment. So you can always go to crisistalk. And see what's been going on. Got the Zoom link right there. Promote 988. Here's all of our old things, old crisis hot seats. If you want to, I like to actually, those are good dinner conversation pieces. If you need something for the dinner conversation. Now we've been off for 2 weeks. There's been a lot of news in 2 weeks. So let me just roll through a few of these that are really important. Calls to suicide prevention lifeline rose 45% since changeover to 988. And if you were on the jam now 3 weeks ago, you heard from Etan at SAMHSA, the numbers were incredible. Our delay time is going down, answering more is going up, everything is going in the right direction. So proud of the work that folks across the country are doing. Remember, people are still asking about the difference between 911 and 988. You can be a voice to help us help others understand the difference between the two. Really important. And as we move forward in our efforts, 911 will move a little bit more away as we get more mobile crisis teams across this country, which is what we're looking for. There's been a lot of talk lately about youth mental health. This was just one from the New York Times. Can you punish a child's mental health problems away? So let's keep an ear out for things going on with youth mental health and bring those forward to this group so that we can make sure that that's part of our conversation. This was a talk by Wendy Farmer, one of our jammers this last week, and talking about the cost savings of 988. So you might want to check that out. You can visit that from Open Minds. All right, now everybody has been waiting for the big reveal about what is going to be our challenge that we're going to take on starting at the 100th episode. So here's something that I wanted to, a quote we wanted to share. The anthropologist is rarely stationary. Rather, this is the person who ventures into the field to observe how people interact with products, services, and experiences in order to come up with new innovations. And in fact, myself, when I started my career 20-something years ago, one of the first teammates I had was a psychiatric anthropologist, and I learned so much from her, and she's still one of my best friends and improves everything that I do. Why are anthropologists so important? Because they actually go into the field and really investigate what it's like to have a certain experience. And that brings us to our challenge, which is starting at the 100th episode, let's start getting closer to that experience. We're listening within this call. We've got the new lived lens, but really, how can we be sure that the care we're delivering really feels like care and not punishment? And so we're really going to dive deep into this next week, but that's the challenge that we're revealing on this call today. care that feels like care. Don Berwick will be with us. And although he's an expert and had experiences across a lot of different agencies and healthcare innovations in this country, he's going to help us really dig deep into the patient experience. And so let's all tune in next week. And I know a lot of people on this call have been close to that experience or had that experience, and we're looking for that voice to help us in what I hope to be the next 100 calls. All right. So we really want to talk today, and I invite Corbin Standley forward. Thank you. I see you. Really looking forward to your talk today on Project 2025. Welcome.
Thank you, Amy, and thank you everyone for joining the session today. As you can see, I am not Renee Cruz. Unfortunately, she was not able to join today, but I am happy to fill in for her and talk about our bold goal at the American Foundation for Suicide Prevention, Project 2025. So as all of you well know, suicide remains a leading cause of death in the United States. And the graph on the screen here shows the rates of suicide in the US per 100,000 between 1995 and 2018. Between 1995 and 2020, and between 1999 and 2018, we saw the national rate increase by about 35%, and we did see decreases in 2019 and 2020. And based on preliminary data, it looks like we may be seeing increases in 2021 compared to 2020. What we know is that suicide is complex, but it can be prevented, and we know that there are actions that we can take that are proven to lower the rates of suicide. And such as providing suicide prevention education for more people, including frontline professionals, and temporarily reducing access to lethal means when somebody might be in a state of crisis. So what is Project 2025? It's a nationwide collaborative initiative developed and led by AFSP to reduce the annual rate of suicide in the United States 20% by the year 2025. And it's a bold goal at the center of AFSP's mission. And so our approach to saving the most lives in the shortest amount of time, the first step was with our expert panel of advisors that we convened, was to review the data and the scientific research to identify the settings and the best evidence-informed strategies for preventing suicide within those settings, again, with the goal of saving the most lives in the shortest amount of time. Our next step was to start developing key partnerships within those settings and to invest in the development of the tools and resources to support the delivery of suicide prevention program in these settings. AFSP knows that we cannot do this work alone, and so we need the help of leaders in all four of the critical areas that I'll talk about in a moment to support Project 2025 in communities across the country. Once we identified those critical areas, we also identified the partners that we would work with. We knew we would need to work with them to deliver resources and programs in each of those areas at both a national and a local level. We know that a one-size-fits-all approach doesn't work when it comes to suicide prevention, so tailoring those strategies to local communities was also really important. And then finally, we're using what we learn, measuring outcomes, and working to grow partnerships and develop more tools and resources. And with these four steps in place, again, our goal is to save the most lives in the shortest amount of time. The four focus areas represent settings rather than groups of people because our expert panel determined that we can reach the most at-risk individuals by focusing on these four settings. The four critical areas we've identified are firearms, healthcare systems, emergency departments, and correction systems. Again, we determined that we could focus on these settings rather than on groups of people because that's where we determined we were losing the most people to suicide. So what are our strategies in each of these areas? We know through research, first of all, that educating firearm owners on suicide prevention and how they can practice safe handling and secure storage can help save lives. So our firearm strategy is focusing on working with firearm owners. We've therefore partnered with firearm retailers and range owners to provide suicide prevention education in communities across the country. Through Project 2025, we show firearm owning communities how to spot the signs of suicide risk in themselves and others, implement secure storage practices, and promote help-seeking behaviors in times of distress. We have collaborated with the National Shooting Sports Foundation, which is the lead trading organization for firearm ranges and retailers, and they have demonstrated a significant commitment to suicide prevention. We don't agree with NSSF on everything, but we do partner with them on suicide prevention because that's where our missions overlap. And through this partnership, we're delivering an education and awareness campaign, which includes content on suicide prevention, safe firearm storage, and seeking help for mental health to NSSF's more than 8,000 members, which is comprised of firearm retailers, rangers, and instructors across the country. The NSSF conducted a survey of its members in 2017 and 2019, and we found that 91% said that they see suicide as preventable. And exposure to suicide prevention education grew by 5% between 2017 and 2019. And we're continually working to increase that number even more. You can see some samples of the co-branded materials that we've developed with them on the screen. These are currently available for free. And so if you want to learn more, you can reach out and we're happy to connect you with your local AFSP chapter and get those materials to you for free. As another part of this collaboration, we also developed a presentation called Talk Saves Lives, an introduction to suicide prevention for firearms owners. And this is a special module of our signature suicide prevention program that's again available for free, either in person or virtually. And we encourage you to connect again with your chapter to learn more about how you can implement that program in your community. Next slide. In the healthcare space, we know that a key strategy is to work with healthcare systems and accrediting organizations to accelerate the acceptance and adoption of suicide prevention practices across healthcare settings, including in primary care. Through Project 2025, we're working to ensure that healthcare providers are empowered with the training, tools, resources, and institutional support that is necessary to identify the signs of risk and to make the right assessments, treatments, and interventions that can help to save lives. AFSP has partnered with SafeSide Prevention to implement innovative and scalable suicide prevention intervention training to primary care physicians across the country. The SafeSide Primary Care Training Program is designed to enhance physicians' comfort level with conducting suicide risk assessments during primary care appointments, including well visits, and to help deliver basic intervention and referral to the appropriate care. This primary care training is fully compatible with Zero Suicide, and it's something that we are scaling up across the country. And in fact, during our last fiscal year, we increased delivery of SafeSide prevention by over 600% compared to the prior fiscal year, so that we are seeing more acceptance and adoption of SafeSide and other programs in the healthcare space. In addition to the SafeSide partnership, we are a membership organization of the National Action Alliance for Suicide Prevention, and we co-wrote and developed with them the Recommended Standard Care for Suicide Prevention and Healthcare document, which is available for free on our website, that provides some standards of care for suicide prevention in the healthcare space. Just this year, we're also launching 2 brand new, very large scale initiatives with the Institute for Healthcare Improvement and the American Academy of Pediatrics. Our Institute for Healthcare Improvement effort will launch later this fall, and we will be implementing process and procedural improvement strategies and quality improvement strategies for large healthcare systems to implement suicide prevention and embed it as part of the normal procedures and policies within healthcare systems. We know that suicide prevention can't just be an add-on in primary care, behavioral health, or emergency care, but that it needs to be embedded in an the organization itself. And so that lines up with the Zero Suicide model, and we're working with large healthcare systems across the country to develop those innovative strategies, pilot and implement those strategies, and then scale them up when they work. You may know that we partnered with the American Academy of Pediatrics earlier this year in partnership with the National Institute of Mental Health to develop and release the Blueprint for Youth Suicide Prevention. We are now going to be using that blueprint as a curriculum for our Project ECHO initiatives, ECHO standing for Extension of Community Health Outcomes. And we'll be working with pediatric clinicians and practices across the country to embed the blueprint practices related to clinical care, clinical community partnerships, school and community strategies, and policy and advocacy solutions, and embedding them and training them in how to effectively embed suicide prevention in their care in primary care practices. So 2 big initiatives launching this year in the healthcare space, in addition to the work that we have been doing. Next slide. The next focus area for Project 2025 is emergency departments. Research shows that about 39% of those who die by suicide make an emergency department visit in the year prior to their death. So this presents another key setting with a tremendous opportunity to help save lives. By working with emergency departments, we can provide a safety net by educating and equipping emergency physicians with the suicide prevention tools they need to screen and care for at-risk patients in emergency departments and other acute care settings. One of the biggest challenges to this in emergency departments is the absence of a quick and easy to follow procedure that physicians can access to use to assess patients. So we partnered with the American College of Emergency Physicians to develop and deliver this brief suicide risk assessment and intervention tool called iCare2. And this tool is freely available online for any emergency physician, nurse, or medical student. And with our partnership with AFSP, we are reaching more than 40,000 members, including emergency physicians across the country. Next slide. We also know that suicide is the leading cause of death in jails in the country and has increased 30% in prisons in recent years. And so we believe that jails and prisons represent a setting where we can have an immediate impact on saving lives. So we're working with key partners in the corrections environment to bridge the gaps in suicide screening, improving correctional healthcare settings, training, and increasing suicide prevention education in the correctional environment. By doing these things, we can change the culture of suicide prevention across the continuum of the correctional system and help to save lives. AFSP has partnered with the National Commission on Correctional Healthcare, which is one of the largest correctional healthcare accrediting organizations in the country. And through this partnership, we co-developed and published the Suicide Prevention Resource Guide to improve the standard of suicide prevention care in jails and prisons. This guide includes case studies, insights into assessing suicide risk, best practices for treating at-risk individuals in the correctional environment, and how to develop a training curriculum. This guide is available for free on our website, which Joanna has put in the chat. Thank you, Joanna. And we also created a specialized module of our Talk Saves Lives presentation focused on correction settings that we are implementing in both Iowa and Indiana, and as well as Arkansas, and scaling up across the country. And we're now training all of the correction staff in Indiana and Iowa in that program. This program was launched last year, and it provides correction staff with information about what can be done to create a safer environment for people in custody, such as how to recognize warning signs and offer support to those who may be in custody and who are struggling, and helping them to access crisis services if necessary. And it also offers self-care strategies and guidance for correctional staff to take care of their own mental health, given the unique challenges of the role. And I'll also mention that in the correction space and the healthcare space and the firearm space, these are the strategies we're implementing on the ground, but we're also work very closely with our policy team, with Joanna and Laurel and our policy team, to work on state and federal policy priorities related to all of these areas, including decriminalizing mental health, requiring suicide prevention education training for physicians and medical providers, and other legislation related to all 4 of these critical areas. Next slide. So as we establish more key collaborations and partnerships in each of these 4 critical areas, it's been estimated that we can potentially reduce the suicide rate in the United States to its lowest point in 30 years. Those 2021 numbers that are preliminary from the CDC are concerning, but we also know that we can double down on the efforts that are working. We can reevaluate the things that aren't working, and we can partner with our communities to learn what works and what doesn't work. A key aspect of this work is also health equity. That's something that we embed throughout all 4 of our critical areas, focusing not only on who we're reaching, but who we're not reaching, and what the reasons for that might be, while incorporating the perspective of lived experience into all of the work that we do. And for example, our steering committees for both our Institute for Healthcare Improvement and Project ECHO initiatives have lived experience representation on those steering committees, because we know that that is an incredibly important perspective that we need to embed in this work. And so we are always happy to explore new partnerships in this area, in any of the 4 critical areas, and are grateful for any interest and investment in this work. Next slide. So again, thank you for allowing me to join you today, for your time and your attention. And please feel free to visit our website at project2025.afsp.org to learn more about this work. You can also connect with your local AFSP chapter. We have AFSP chapters in all 50 states and in Puerto Rico, and they would be more than happy to connect with you as well. So again, thank you for your time and thank you for having me.
Corbin, excellent. And I think a lot of people are really impressed with these goals, and the focus on those 4 specific areas are really just make a lot of sense. So I'm happy to ask forward Sarah Bramett and Misha Kessler as our roundtable participants today. Why don't we start, Sarah? Why don't you start with some of your thoughts?
Yeah, thanks, and happy to be here, and really appreciate you, Corbin, stepping in. I thought you did an excellent job. I really appreciate the aspirational goal that AFSP sets before all of us, and the opportunity to collaborate on those shared priorities. Anyone that knows me knows I have a very soft spot in my heart for lethal means safety efforts, and I really appreciate AFSP's collaborative approach to working with the firearm community to ensure that strategies and messaging really resonate with that community, and that you're partnering with those trusted messengers, since the firearm community is who we're hoping to reach. So I really appreciate that. I think this also identifies other opportunities for folks to fill in areas that might not fall within those 4 priorities, and really collaborate in those spaces as well. And I think there's a big challenge before all of us, and this isn't on AFSP, this is for all of us, that when we're looking at national aggregate fatality data, we might be missing trends among communities that might be rendered invisible by just looking at that, particularly our communities of color. And so we miss what we don't measure. And I think there's the challenge before all of us to push for better data that doesn't render communities invisible, not just our communities of color, but also looking at data systems where we can be bringing to light other identities, sexual orientation, gender identity, that aren't measured in our national data streams, and that we're missing, what we don't measure. And so I think that's a challenge before all of us, so that we can see success across all of these communities, not just at the national aggregate fatality level. But really appreciate you, Corbin, for being here, and AFSP for setting those big goals for us and for the field. I'll pass it over to Misha.
Yeah, thanks, Sarah, and thanks, Corbin. I certainly appreciate the as Sarah says, the aspirational goals. And I think what really resonates with me, for those who I haven't met, I'm a suicide attempt survivor and a lived experience advocate. What really resonates with me is just how tangibly this can have results in an individual's life. I think it's it's very impressive statistics that you've presented today. And I think what turns that into a very meaningful thing for me is recognizing where that could have made a difference in my own journey, and where it did make a difference in my journey. These kinds of aspirations, these kinds of goals that allow us to really tangibly help someone who is in need is a critical piece. And Corbin, I highly appreciate your nod to lived experience inclusion, because I think it really is the story that makes these things tangible. It's the story behind the lived experience that makes these things urgently important to us. By way of story, by way of anecdote, prior to my own attempt, I experienced many care coordination failures. I experienced many challenges in being able to pay for therapy, for things that easily, or perhaps not easily, but things that would have helped me avoid greater levels of acuity, would have helped me avoid greater crises. I was unable to achieve those things even as I sought them, even as I tried. And even after my suicide attempt, fortunately, I had the privilege and I had the means to seek care, the care that I really needed, But even then, I continued to experience care coordination failures that made it very, very difficult to adhere to my care. Now, of course, a decade later, I'm very glad and very honored to be included in these conversations and to be able to say that I've recovered well. But it still is looking back to that experience and seeing just how these aspirational goals, just how Project 2025 can actually make a difference when it comes to care coordination, when it comes to individual experiences, when it comes to means restriction, when it comes to protocols, making sure that organizations have protocols and policies in place to protect individuals in their greatest time of need. So anyways, I'm very excited to be here, and thank you again to Corbin and to AFSP for this work.
I think all three of you will see in the chat that what you're talking about really resonates with a lot of folks. And it really, Misha, what you just pointed out really plays into our challenge that we're looking to after the 100th episode. As we've been saying on this call, when we rolled out 988, we were at the starting line. Now we're going. And what does the next part look like? How do we really make care feel like care? And you pointed out several pain points that you experienced, and we need to be addressing all of those. And I know I'm speaking to the choir here. We all want to do that, but we also know it's not easy, right? You'll see the logo in a few minutes, it's like climbing a very, very big mountain. But I think we're up to the challenge. We want to make sure that we identify what those are, and then we pull them apart one by one through funding, through advocacy, through just making people report on the money that they're using, and they're using it in the right way. So there's a lot of different ways that we'll be doing that. So Corbin, thank you for stepping in. You were a speaker that didn't even sound like they were stepping in for someone. It was wonderful. It was very informative. Sarah and Misha, what a pleasure to hear from you. Thank you so much for joining us on the Jam today. So, we have to put in our usual plug for the t-shirts. I kind of was plugging it at the beginning. Those of you who are starting, I don't know about you, but I've already heard a Christmas carol / commercial. And Hanukkah's coming too. So these are wonderful gifts, 988 t-shirts. So check it out and see what you can get. I saw a lot of people were suggesting long sleeve shirts and sweatshirts we should get, but yeah, feel free to get your 988 shirt. They're very comfortable and really like them. All right. So we're not going to play this ad today from Ad Council. But if you tune in next week, it might be playing as we begin the 988 Jam next week. And you're going to want to tune in because it's a really interesting video, really trying to reach the young folks, the youth around talking about suicidal thoughts, depression, etc. So tune in next week to hear a little bit about it, but it's really a good lead in to our trivia hot seat today. I think we have C.W. Tillman here to participate. Hello, I see you. Hi, thank you so much for joining us today. So good news, the trivia hot seat's a great one today. And I have a lot of support things to help you with the decision making, which is great. So let me show you the question. And we always get our audience members who are brilliant to help us with the answer. But let me read it to you. JED Foundation, AFSP, and the Ad Council are behind Reach Out and Seize the Awkward. Having a conversation about mental health might be uncomfortable, but it can make all the difference. Which of the following stars is not featured in their online video, Whatever Gets You Talking? So our choices are Addison Rae, Mixum Toon, Mike Myers, and brothers Zach Valentine and Pat Ramirez. So first thing we do is ask our audience to put in their votes. I don't know, CW, if you already have some thoughts in these interesting folks. Have you heard of them?
There's quite a, I've heard of most of them, so.
Well, that's impressive already. So in a minute, we'll have some results from the audience. And then I'm going to give you a video clue, which is also hopefully going to help you get to your final. But are you already kind of thinking what you think might be the answer?
I have some thoughts.
Okay, let's
So
see what
far.
our audience says. I like that some people in the chat are saying they don't know any of them. Okay, so we've got a clear vote from the audience. Mike Myers, they think, is the person not in the video. And then looks like everybody else is kind of within a standard deviation of each other. So I'm not sure that. Now let's give you a video clue.
What's up, Crisis Jam in person, currently sweating in the hot seat. I'm Will Covington, son of David Covington, and I'm currently in Scotland. That's a castle. But basically, the thing is, when we look at this question, we got Addison Rae, MXM Toon, Pat Ramirez, and Zach Valentine, and Mike Myers. Now, since you're an old person, you probably don't know who 3 of those people are. And you might know who Mike Myers is. But take it from me, the youngling, that Mike Myers was definitely not in that video.
Well, all I have to say is that he said the person's name is XMM Toon, and of course I said it a totally different way. So I think we already know that I don't know who that person is. So what do you think? What do you want to choose for your answer?
So my original answer was C, and so with the audience and David's son helping with that, then my answer is going to be C, Mike Myers.
All right, final answer C, Mike Myers. Let's see
So-
where you are. Yes. You, a 14-year-old in the jam, got it right. So proud of you. Your t-shirt will be on its way. Thank you so much for joining us today for the hot seat. All
Thank
of the A, B, and D are all top earners and influencers, TikTok, Instagram, etc. These are people who are the ones our youth are listening to. And so kudos to Ad Council and others for bringing in the voice that can actually change the way that we address suicide in our country, getting people to talk about it and to remove that stigma. Yay for that. All right. Now, Sarah Blanca, I hope you're here. There you are. A past jam host, and also
proof.
now, yeah, there you go, your t-shirt. I love that. Now at Optum Health, and we have the privilege of having you today in another part of the jam, the lived lens. And so really looking forward to hearing from you and your perspective to help us get up this mountain.
Yeah, thank you, Amy. And I love that hot seat. I think the Ad Council really hit it on the head if most of us don't have any clue who most of those people are. So David had told me that part of what we're thinking about with the lived lens is what the last mile of crisis care really looks like if we have that robust system. And so for me, that last mile really looks like finding purpose again. And purpose is one of SAMHSA's pillars of recovery. And I would argue maybe the most important one. And it's personal to me because when I was navigating the world as a young person with depression and suicidal thoughts, and I'd had experience with receiving services and hospitalization, I really felt ashamed of my diagnosis and my need for those services and treatment and my history of suicide attempts. And I really wanted to compartmentalize or shut off that part of my life so that no one I loved would think of me in that way as like a broken person or somebody that was, maybe struggling to keep things together. And I worried that I wouldn't be considered, reliable by an employer or stable by my friends and family.
And I believed that if I actually disclosed my history or my current treatment, that I'd always be seen as a mental health patient and not a whole person. So I really denied that part of myself and pretended that it wasn't me. But as I started to provide emotional support as a peer to someone at my local mental health center, I started to feel things shift for me in that way. And it started to feel like maybe I had a special skill set or some kind of advantage that the licensed clinicians and the case managers didn't have, because I had been there and I understood things that the clinical team did not. And it shifted my perspective that instead of something being wrong with me, there was maybe something that was right with me. And what I saw as my deficits really became an asset. So it empowered me to start sharing my experiences with loved ones, and it created a feeling of purpose and meaning back into my life that I really had been missing. And I had to really learn to reintegrate that part of my life back into my everyday world. And it was only after I did that that I really felt like a whole person and like someone not that was broken or hiding, but someone that had something to share and to offer to the world. So I think really to fulfill the promise of 988, we have to plan for opportunities to reestablish meaning and purpose for people. And it's not enough to not be sick. We need to help people be truly well. And I think that requires having that purpose or, a mission in life. So for me, finding purpose was getting back into the field that had once served me to figure out how I could serve others. And for some, it means reconnecting, some prior passion or role in their community. But I think purpose is really about connecting to something that is bigger than yourself. And I hope that we really continue to elevate that as a part of our recovery and sort of the finish line of robust crisis care. Oh, I think you're on mute, Amy.
I showed myself, but forgot the mute part. I really liked how you talked about integrating those two parts of yourself. A lot of us wall off or compartmentalize different parts of ourselves and show them only to certain people, or maybe to no one. And I really liked that idea of, we think about that a lot, the whole person, but maybe not enough. When we think about recovery plans and we talk about what makes this person a whole person again, right? And so I really liked that, the way that you put that. So I appreciate that so much, and for you sharing that. And David Covington is singing your praises in the chat, which is amazing. So thank you so much for sharing today. And again, we keep putting little steps on this mountain to get us there. And all of these voices add up, and so appreciate both you sharing your experience and also the work that you do every day to help us get up this mountain. So thank you so much.
Thank you.
All right, shall we move on? Wonderful. All right, another one of my favorite spots of the Crisis Jam. Stephanie Hepburn here sharing one of her recent interviews with Daniel Hodby, and looking forward to hearing about it, Stephanie.
Hey, Amy, thank you. Yeah, so I'd like to welcome Daniel Hodby. Daniel, can you share a little bit with us what you were experiencing during the pandemic?
Yeah. Hey, good afternoon, everybody. Thank you for having me on this jam. Congratulations to 100. During the pandemic, I went through the gamut of emotions, but mainly it was the disconnect. And Sarah mentioned earlier, it was the lack of purpose that really got me, and the isolation. It's a very scary place just to feel unconnected. Humans as a whole, we're pack animals, and the opposite of addiction and mental health issues is that connection. And I lost that, and I felt isolated and alone, like I didn't have anyone to talk to. And I tried to fill that time with hobbies. Some people had baking bread. I took up gardening, extreme gardening.
Extreme gardening.
But yeah, thing. And
you talked a lot about your experience coming back from Iraq. And it was interesting to me because you paralleled that hypervigilance that you experienced and then what that was to then be in isolation, because I think you're right, it going into isolation, the pandemic was jarring for all of us. But if you're experiencing hypervigilance, you know, that must have been profound for you. Can you talk a little bit about that?
Yeah. Going from a situation where you're constantly amped up, you're ready for something, and then there's just nothingness, like in a disassociation, a disconnection from everything, but your mind is still going a million miles a minute, looking for, like, you know, patterns in the static, looking for, like, you know, answers in shadows, and it's just it eats at you. And when you don't have anywhere to place that energy or anyone to talk to, and you already suffer from mental health issues, it just compounds on itself. It's sitting in that beige room, and it's the absolute worst. Like, it's a waiting room to nothing with no end in sight. Like, and I know going through that, there were supportive services, but having things like this, the jam, or having healing circles digitally, and all these other things, and 988 now coming through, where I would have had a number to call, like, you know, and I could, like, hey, at least somebody's out there, you know, that would have been big. And I'm so thankful that this has started to take off and it's coming to fruition, and those crisis services are coming in, because I truly believe catching people before the crisis is the key, but having that support there is necessary.
And sorry to interrupt you, but lastly, I think, you know, you talked about being able to breathe again when meeting with peer support services at the Bridge Center. Can you just talk briefly about what that felt like? You know, that you know, your analogy, you're very descriptive, and that's one thing that, you know, directing people to the article, you're so good at explaining how you're feeling and how you felt through the process. Can you talk about what was the turning point for you?
Yeah, I owe my life to peers. The hurt in me was recognized by the hurt in them. And when I walked into the Bridge Center for the first time, I was terrified. Like, for the first time in a long time, I was terrified. I wasn't afraid of, like, losing my life, or, you know, but I was afraid of being misunderstood. And when I walked in there, you could feel the compassion. Like, you know, you ever walk into somewhere and you just felt, yeah, this is for me. This is okay. This is safe. This is good. They saw me. They saw me as a person going through something, not a person with a problem, a person going through something. And they sat and they listened, and then they shared. And then I saw myself in them. A gentleman that I had the pleasure of meeting once told me this phrase that helped change my life: people don't care what you know until they know you care. And they showed me they cared. And I am now proud to say that I'm a peer support specialist, and it's all due to having someone that is going through that shared bond. It may not be the same battle, but there was a battle.
Right.
I could see that warrior spirit in them, and they sensed it in me. And together we got the chance to heal. And there's nothing more powerful than a group of people with the same purpose on a mission for good.
Thank you so much for hopping on the call. Amy, I'm going to pass it back to you.
Daniel, powerful. You'll notice that in the chat, a lot of people are using what you said as quotes, and some of those may live on in the jam in the next few weeks as we reflect on what you shared with us today. Thank you so much. All right, I'm going to turn it over to John Palmieri for the SAMHSA update.
Thanks, Amy. Good to see everyone again and agree on the power of those words. Just incredibly moving. So just wanted to provide a couple of quick updates from SAMHSA, and then I'll hand it over to Dr. Richard McKeon, who will provide some additional updates there. Wanted to just remind everybody that there is an announcement out for funding opportunity for tribal organizations, tribal nations on 988 response. That application is closing on October 25th. So a couple of weeks from now, the announcement remains available on the samhsa.gov grants page. And there as well is a link to a pre-application webinar, which has some additional information and answers to some common questions around the application. So hoping to draw attention to that opportunity. Wanted to also flag that we are continuing to, I think, benefit from the post-transition increase in chat and text capacity. I think that we've flagged some statistics in terms of response rates for chat and text, and really just want to emphasize that, particularly in the context of what we know about youth and young adults, largely people under 25, using those communication channels, and many of them, upwards of 80%, identifying active or recent suicidal ideation at the time of the chat and text. So younger people in more acute distress and wanting to make sure that there's awareness of the capacity that exists within the system to serve those individuals, particularly through chat and text. There will be more information forthcoming about our recent work with Vibrant and the Trevor Project to launch LGBTQ+ youth services. But just for awareness today, that service has launched at the end of September, both through chat and text and through an IVR menu option where people can select to be connected to specialized services focused on LGBTQ+ youth. It's been a lot of months and years in the making, so happy that that's finally off the ground. And like I said, we'll be providing some additional information about that pilot in the weeks to come. Wanted to also highlight that the Assistant Secretary, Dr. Delphin Rittman, is down in Puerto Rico, visiting a 988 call center there, and that they will be an integral part of our overall plan to increase capacity in the Spanish subnetwork and answering crisis contacts for individuals who speak Spanish. And that related to that, there's also a lot of work underway focusing on increased language access for people who speak Spanish through chat and text as part of our FY23 plan, and we'll have more information on that coming soon. And I think that's it for me, and I'm going to turn it over to Richard.
Thank you, John. So I will just mention a couple of things quickly. We have, SAMHSA has been part of the International Initiative for Mental Health Leadership for a number of years. Last week, we had a series of 5 webinars available to registrants from the member countries, which are the US, Canada, England, Ireland, Scotland, Northern Ireland, Australia, New Zealand, Sweden, and the Netherlands. And there will also be a face-to-face meeting in DC for the North American contingent, and meetings taking place on other continents as part of this larger process of information exchange among these countries. But there were a couple of noteworthy things about the webinars last week. One was focused on 988 and 3-digit numbers that include not only around the US, but also Canada, who I think, as you know, has made a determination that they will also be moving forward with implementing 988 across Canada by a date later in 2023. There was one on data and surveillance systems with obviously some really state-of-the-art surveillance systems in other countries, Ireland, for example. And also one on national strategies. And I was particularly excited to hear that the program called Lifespan in Australia has now begun to show data of effectiveness in reducing deaths and attempts. And in my judgment, the work in the Lifespan Initiative through the Black Dog Institute in Australia, is some of the strongest suicide prevention efforts that have been done on a population basis anywhere. So I think there's a tremendous amount that we can learn from them. So at any rate, that was what I wanted to report on, and have, if people need more information about the International Initiative for Mental Health Leadership, I'm glad to provide that offline as well.
Thank you both to Richard and John, both for the work that you do and the leadership that you provide to us through your work at SAMHSA. I'm going to turn it over to now the NASHBIT update from Arlene Stevenson, Senior Advisor at NASHBIT. Sarah, Arlene, are you here?
I am.
There you are. Great.
Thank you for the opportunity to tell us about you about NASHBIT's new resource. We are developing a behavioral health parity playbook. It is on strengthening laws and partnerships. And the purpose of it is to increase parity between mental health benefits and substance use benefits and medical and surgical benefits. There is an imbalance between how insurers pay for those two sets of services. This is important, first, because it's a person's right to expect their insurance company to pay their claims. After all, you paid the premium. Also, it's a very important component of the financial stability for crisis services. So it's something that states are all looking for. The federal government has addressed this through multiple parity laws over the years, and also through the oversight. They're enforcing those laws, but they're very complex. And the states have stepped up. They've also are creating and have created their own laws. They're doing their own oversight, but unfortunately that just creates more complexity. So the playbook is designed to discuss, where the states and where the behavioral health authorities fit in. We're explaining the laws and the regulations, how Medicaid fits into this, and there are resources for developing legislation, stakeholder partnerships, because there are multiple players in the states. As I mentioned, Medicaid is often your Attorney General, it's the Behavioral Health Authority, and the Insurance Commissioner. So how do these four entities all play together? And then we're also looking at state actions that have been taken and some best practices. So this is a resource that is coming soon, and then that'll be followed by some additional related resources, such as improving coding and billing, because that's important to maximizing the financial aspect again. So it's all coming soon, but in a nutshell, that's what it's all about.
Thank you, Arlene, for that update from NASHBIT and the parity resource that's coming soon. I'm going to turn it over to Sarah Cochran. We're happy to get some federal updates back on the calendar again.
Thank you, Amy. And I'll start out in the House. Towards the end of last month, they passed the Mental Health Matters Act. That is coming out of the House Committee on Education and Labor. And given its focus in the labor and education space in particular, it is not a committee that is on this chart that I often update on, but it does have some provisions on strengthening parity, which is largely under the Department of Labor's purview in certain regards and certain plans. So that's an interesting one that passed towards the end of last month. On the Senate Finance update towards the bottom right of the screen here, that box, in September, late September, they released the third work group draft as part of their mental health process that they announced last fall from the Senate Finance Committee bipartisan mental health process. That was the workforce draft that was released, and previously they've released the telehealth and children and youth drafts. We are still waiting on the integration and access to care draft, which we are hearing is being referred to as the crisis draft now. So hopefully more to come on that one next. And the final draft that we expect to see at some point is the parity work group draft. But that one still seems like they're working out the nuts and bolts there. I will pass it to Joanna to give an appropriations update of where we are at this point in the new fiscal year.
All right, so as many of us already know, recently a CR was passed, and what that is a continuing resolution. It's an interim budget to sort of placehold to keep the government from shutting down when the current fiscal year is almost over and Congress does not have a final budget for the next fiscal year. So included in this continuing resolution, which was passed last month and will be in effect until I believe December 16th, was a $62 million anomaly for the 988 Suicide Lifeline activities and behavioral health crisis services for fiscal year 2023, which will carry out through September 30th, 2023. So this funding will be available through next year, but the bill itself will run out in December 16th. It's a little confusing. Hopefully this is a good, quick explanation. I got a request to translate all of these budget terms into layman's English. So hopefully that explains it. Now this $62 million will be available over the course of the year, and that will come in addition to whatever is included in the final FY23 budget. Now we're really hoping for a budget by December, a final budget, and we hope that the House and Senate won't need to have another CR, but we'll have to keep an eye on that and see. That's my quick appropriations update. Thank you.
So good to have the both of you back and keeping us updated. All right. So are we going to ask for, is Stephanie here, Pasternak, to give us a little update? Wonderful.
Yeah, thanks. So we've had a change to our map, the first one in a few weeks, and that is thanks to advocates in California. So Assembly Bill 988, the Miles Hall Lifeline and Suicide Prevention Act, was signed by California's governor at the end of September. And let me tell you, this bill is a big deal for several reasons. It sets up sustainable funding for call centers and mobile crisis teams through a small telephone communication surcharge or fee. And for anyone that is counting, that now brings us up to 5 states that have taken advantage of that particular funding opportunity. It also sets up a plan for coordinated implementation and long-term planning for 988, including how it's going to interface with 911. And finally, strengthens insurance coverage for behavioral health crisis care using the state's pre-existing medical necessity law. And just for some quick shout outs, California bills can have organizational sponsors. This bill has been sponsored by the Steinberg Institute, Kennedy Forum, Los Angeles County, Contra Costa County, Mental Health America of California, NAMI California, the Miles Hall Foundation, and NAMI Contra Costa. So apologies if I've missed anyone, but just wanted to say congrats and appreciation to those organizations and really all the advocates and partners involved with this, as I know it was a 2-year effort to see AB 988 over the finish line, but happy to share the good news.
Yay, California. I'm a proud Californian and I'm so happy that we got a yellow on the map now with us. So thank you so much, Stephanie, for joining us and being here this week. All right. Next slide. As we know, we're still working on our cards to update, make sure that we represent each state in the work that they're doing for 988. As we begin to move forward, we'll be adding more of those. Remember to always check in on Moving America's Soul. You saw in the chat today, another great one is coming right around the corner. So keep an eye out for that. They're really moving movies. The Craig Miller one was recently released. Okay, 100th Crisis Jam, the challenge, care that feels like care. We need you there next week because it's going to be a celebration. Plus an information. We're going to have so much great, it's kind of jam-packed. So be ready for a quick moving jam next week. Wear your shirts, bring your hats. It's going to be a party. As you look for who's coming up, I just want to share, thank you so much to Corbin Standley, who was on today telling us about Project 2025, Sarah Bramett, Misha Kessler, both on the roundtable, C.W. Tillman for the hot seat, Sarah Blanca for giving us her lived lens input, Daniel Hobdy for Crisis Talk, and of course, our special appearance by Will Covington. I thank all of you for joining us today. Be here next week for the 100th Jam. And as you can see here, you can always visit the website and see what's coming up. I appreciate seeing all of you today. Thanks for joining us, and we'll see you next week. Bye-bye, everybody.